久不见哦。
很久。
Hello everyone, I'm Priscilla. I'm so happy to see all of you here. Thank you for being with us for today sharing about how to choose an appropriate dance conditioning. So this is Ms Gan. She's my ex-ballet teacher. Yeah, so I pass to her. She will do some introductions and also the sharing.
Hi, good morning. Let's see. Can everyone, if possible, switch on your video so can see your face? And because of many new faces, young dancers, young teacher that I don't never meet before. And okay, let's see. Can I share my screen? Right, you can see my share screen? Thấy đâu mà? Okay. Welcome to the dance conditioning class. When Priscilla invited me to give this talk, I was thinking what to present. So thinking of sharing some information to teach you guys and how to choose an appropriate dance conditioning. I'm going to share also some of my background. Wait. Right. Okay, this is me. My ballet trained under Mr. Wong Fok Chun. I hope you heard his name. And I trained my contemporary dance under Mr. Chu Thi Quang and also Miss Lok Sok Kim. So during my apprentice teaching, I was teaching at Victoria Dance Art, where Mr. Wong owns it. I taught there for about 3 to 4 years. And yeah, at that time, Priscilla is still very little, and now mothers of 2. And then I actually went to study for my bachelor in Australia. I gained my teaching certificate in Australia while I was studying in the 2nd semester after finished all the core subjects. So I still have a kind of like dream like you to fulfill something in dance. So then, yep, I got my very short period, gained my I have my teaching books, materials, and then study there for like about a few weeks. And then the organizer in Australia, in Perth, basically, and she organized an exam for me. And then I did my teaching certificate and I got in distinction. Yep. So then I came back and Miss Yip who owned Dual Space, and she invited me to teach in her studio, which that time I was still in full-time in my job in private sector. So then I actually formed a dance and Pilates studio in 2006 with Miss Ong Hui Kun. Yep. And during that time, I actually become a CBTS tutor 402. The name is quite long, Safety, Health, Something Practice. For about 2 years. It's actually a very busy years that time. And I will share some of the comments when I was a tutor, because this subject, who is actually a CBTS tutor? I think I see some of the familiar names that I don't see names that under my coach before last time. Yeah, Shi Hui, right? Yes. So when they submit the assignment about warm up and also the cool down exercises, I think I'm going to share some of the ideas here, how to improve your program if you're still teaching, right? Okay, then I also participate in the in different performances, mixed bill, and during the time that I was dancing in Victoria Dance Art, The flooring is actually very good. That Mr. Wong kind of like form flooring that produce dancers to absorb a lot of shock absorber when we have a leak, because the dance floor is kind of made by a spring. So I actually has a zero injury during my ballet training. But when I was doing my intensive ballet, not ballet, it's a contemporary performance in one of the community center that don't have any good flooring. It's only on cement floor. So 1 week intensive training, and then we have to perform. And I actually injured my knees and my kind of my spine. So because of MCO now, many students actually doing classes at home. So I hope that teachers, you all, when you are doing something like Allegro types, you really have to be careful, right? Yeah, because the shock absorptions is really harmful to the dancer's body, right? So I was teaching ballet for about how many years? Almost 20 years. And how do I get started my Pilates journey is when I came back, I still have to finish my ballet dream to finish my advanced 2 level. That time, all my classmates, they already finished, so left me. I'm the leftover kind of student. So Mr. Wong only can provide me once a week class. So he asked me, why don't you go and find some other ballet classes? But during that time, I was thinking more ballet classes is not, I don't think it's not what I want, because I need something that preps my body to be more, to be stronger, and give me more ideas how a movement move in a better way. So I did Pilates that time, private one-on-one on equipment, and then the Postup Pilates teacher training course came in. So I was thinking, why not I joined the Pilates training course, not just me to teach me myself, but because I already start teaching, I wish to kind of like to have a better teaching for my student, because in Malaysia, we don't have any dance company to support us. It's like comparing our times, that time, ballet teacher, when in overseas, is like, oh, wow, they all join any dance company professionally, how many years, but who am I? I only join dance classes. So in order to equip myself to be capable in my teaching more efficiently, so I was thinking to do something else. Yeah. So then I joined the Postup Pilates training course. So during the training, we actually require a lot of practices. My strength, my flexibility are gained from there. So I passed my exam once a week class. So yeah. So then after 2 pregnancy, I started my gyrokinesis training and also gyrotonic. So both of these gyrotonic, gyrokinesis, and also Pilates, they are kind of like combination for me, even though I don't dance now, but I'm teaching and I'm still doing these 2 methods. They are combination of ballet and contemporary. I will kind of like speak more on that later. So later on, instead of doing more movement, during the period that I see like student, ballet student, dance student, and also my client, that I still feel that the movement is actually not complete yet. I see problem, but I don't know how to treat them. I gotta send my client to physiotherapists, to acupuncturists in order to release those tension and improve a better movement performances. So then later on, I progressed to pursue more manual therapies courses. So it's an alternative treatment, like in a holistic way as in combination of mind, body. So it's not just like, how do I fix this person, but in order to how what's the journey that to help you to understand your body more? Why do you need to do this? How and why, right? So it's a branch out of treatment of osteopathy, if you heard about that before. Rolfing is one of it. Biodynamic cranial sacral, that's cranial, the head, and the sacral is our tailbone. Along the spine, there's a lot of spinal cord, also nervous system, that will actually stores a lot of information for our body. But because of the external force, external environment, stress, that our body tends to forget what we could actually do, like immune system, right? Especially during this pandemic. Whenever now, since many people talk about what medication take when you have this, have you ever thought why not prevent this by having a good habit of diet, which Ming Ni will talk about that, right? Diet, exercise, that all actually boost up our immune system. This is also a preventive steps, okay? Right. So visceral manipulations is on the organ manipulation, that the organ will be actually affected due to some restriction of connective tissue. So yeah, I'm now doing all this hands-on based on all this method to kind of like help the client to in their problems. So what is my current profession now? Anything to do with fascia? Have you heard about fascia before, everyone? Some of you know. I'll talk about that. Fascia, anything to do with fascia? Fascia is a connective tissue that is actually wrapping on our whole body. Our body physically that actually affects that, not just muscles tightness, but also by this guy, fascia, not facial, right? Okay, now anything that also depending on my client's needs. So sometimes they come inside, they have migraine, right? They have migraine. Some clients come in with stress issue. So I have to treat them using either movement or my manual therapy side. So lower back pain, they can come in with a severe lower back pain. Yeah, arthritis, the hip arthritis, the knees arthritis, that they don't want to go for surgery, but they instead of opt for kind of like alternative treatment to kind of build up the muscle strength and realign the whole body postures, so that they prevent of those force either in like knee, if let's say their problem is in knee or lower back. So yeah. So yeah, I do have clients also like about 40-ish, 60-ish that don't wish to do knees or hip surgery. So they came in for all this alternative treatment. And psychosomatic work is like a combination of mind and physical. So I always tell my ex-student during that time, we don't dance like a cow, we dance smartly. So it's a method that could help you dance more efficiently rather than you just practice and practice and practice and practice until your mind and your physical get exhausted. It's like study. You don't study only hard, but you study smart, okay? You are making the learning process efficiently and quality. It's not quantity only, right? So stroke patients also, they came in because after stroke, the movement is actually limited, so that they came in to build up their strengths. And golfer, dancers, tennis player, whether they are professionally or they only like hobby. So I'm doing conditioning for this type of people and many more. So right, fascia. This is how fascia look like. It's like a crystal-like kind of like substance. So when you are moving even down, we are talking. So everyone, I don't see all of you in your video open. Do you mind to sit up straight? So to lengthen your whole spine. Yes. By doing the shoulder shrugs up, the fascia is actually moving. Shoulder shrugs up. That's fascia. The fascia is connected to your muscles, right? In the muscles, a lot of muscles anatomies, they actually divide the muscles nicely. Like let's say this is deltoid, This is trapezius, rhomboid, if you heard and familiar with all the muscles. But fascia is something, a transparent sheath, like for example, the orange. The orange, the juicy bit is actually wrapping by the white thingy flesh, right? That is fascia. In our body, we have that too. But our body one is actually wrapping even skull, right? Inside the head, even inside our organs. So the organs is actually wrapping by all this fascia, bones, ligaments. They actually trap all around the whole body. So when you are doing training, we cannot avoid the understanding on this fascia. All right. And now recently, the fascia thing is kind of like very famous in yoga line, Pilates line, sports line. I'm not sure whether, have you heard about that in your dance training, any other form of dance conditioning training? Have you heard about this word before? You can type in if you're shy to on your video. Have you heard about that? No? Right? Okay. So, yeah. When we're doing movement, now, if you open stretch your hands, come, stretching it out. And yeah. So the tissue is surrounding your hands is kind of fully stretched. And then release. And then fully stretch. And then release. The substance actually, if your body is healthy, they absorbs water, like a water efficiently. But if let's say your tissue is not healthy, the water level doesn't intake. The water level that you intake, it doesn't really absorb to your fascia efficiently. Okay, I'll talk about that when we do movement. By the way, are you okay to kind of like prepare a mat anytime, because I might ask you to do a movement? Is that possible? Is that okay? I can't see all of you, so Priscilla, maybe you could help me too. Is that okay? Just show me a thumbs up. Yeah, there will be one exercise ask you guys to do it. Right, good. Wow, cool. Okay, right. Now, next one. So go and Google it, fascia. Is actually, this terms is very new. They only have a fascia congress to kind of like doing a lot of research on this connective tissue for the past over 10 years only. So very new. You can still pick up. Yeah, right. So this is me. This is Ms. Ong. We are doing gyrokinesis on the chair. So have you ever thought, are you doing dance to be fit, or you are to be fit to dance? Which one? You can type. Have you ever thought that before? Yes, no, why, and no, and. Come on, give me some feedback. Right? Okay. Right. Yeah, let me see. Oops. Oh dear, wait. Hang on. I think I was accidentally out of something. Sorry. Okay. All right. Let's see the chat here. Both. I heard fascia from Lisa Howell. Very good, Shihui. Yes. I will share with this lady also. Usually to dance to be fit, but must be fit to dance. Okay. Very good, Shihui. Yeah. Right. Now. Oh, this is too early. Wait. Wait. Yeah. Sorry. I need to adjust this first. Okay. So for young age dancers, okay, for young age dancers, we actually to do dance. to improve the neuromuscular and neurological. Because as you can see in this picture, the body is so bad, especially now pandemic period. You wouldn't want, whoever the teachers here already have kids, you will know what I mean. They're all on the phone and on the electronic devices so badly. So dance to be fit, it is actually a good idea, right? And yeah, neuromuscular, we could actually help them to improve the development, balance in front back muscles, you know, both sides, right and left, that because ballet actually train both sides mostly, right? Except the dance that we train only one side, right? So neurological also, because when you are dancing, you are doing something in you're training your brain. Like just now I say, the cranial sacral, the brain, the nervous system actually starts from the brainstem and then it branches out. It affects not just your muscular, your movement, your motor control. It actually affects your gut, right? And that one will pass to Ming Mi in the diet side. So gut health, that actually affects that, because if you don't produce a good nutrient, not you produce it, if the nutrient that you take in and they cannot digest it, you will lose energy. That's why people like doing a long period hour of dancing and yet still can keep their energy well. But why you are eating the same healthy food, but why is that not efficient in your body? So all this actually interrelated. You cannot separate it. That's why I say body as a holistic way. So as a young age dancer, I'm sure you know all this, the benefit. We build good discipline, right? Especially now, pandemic, I don't think the discipline is there already, unless, yeah. So they're kind of like out of the track, the best song a bit, right? When they're watching in this screen, you sure they're really watching this screen? They might have another Minecraft or Roblox, another screen on. Yeah. So yes. So improve postures, as you see the previous screen, they're all like slouching, yeah, badly. Shoulder heights up, head up, all this. We create many new turtle after the pandemic. So the cognition is actually helping the children build from young to gain the experience, like oh, they can actually you know move that such a way, and then through experience they relate to their daily activity life as well. So improve proprioception's awareness. Now this word also quite important. If you as a mover, I wish you can have kind of like read through it, Google it. What does this mean? So for short, it's actually an awareness, a spatial awareness within not just space. Yeah, I know that when you exam, you gain points, you gain marks in your spatial awareness within you and the space, which corner to go, right? But now, proprioception is also the space within yourself. The space can be very small, it's only limited to your joint. The joint, the tendon, the ligament, how does it actually move, right? The space, for example, why the person is kind of like, the head could forward and then lift up, and yet they don't see any problem, right? Because the space around the head is kind of like gone. The sensitive, the awareness. So balance the right and left brain, that everyone's as a ballet teacher who is already knows, and many good benefit. But training young dancers, I know there is one. Is it Fatima that is actually primary grade? No, not her. Who is the younger dancer in your
Aurelia.
Aurelia.
She's only primary.
Primary Aurelia. Let me see her. So now see, training young dancers actually it can be quite a challenge, because you can't train them doing dance conditioning, explain in a way that so technical, they will get bored, right? You have to be creative. Like let's say you want to train them in balancing, you have to be creative. What tools to use? I will actually explain this to you later. So choices of movement, the dance conditioning, basically, I meant, is important for you to build young dancers in a long-term and further development. Now, as you can see in these pictures, I'm sure this posture you see most of your children, right? They flare out the ribs. They don't have any core muscles, the abdominal muscles at all. And we call it such a way, this curve, a lordotic curve, a very low doses, LORDORSIS. If you want to kind of Google it, what is that? Yeah, it's a very low doses curve. If this will actually give a lot of stress and compression to the lumbar area, the lower back area. So we do need the core, the abdominal muscles, which is not just your six pack. So I'll talk about that later, to stabilize so that you could create more length on this. So we always need to have a balance of muscular system. Have you now see in our skeleton, we don't have any bones actually in a square shape, like the building block, right? You play the Uno block, right? They build you stack up, they build up like straight, like a structures in our house. It's like they're all square, then they are firm. But in muscular skeleton system, they don't actually have any bones that are actually square. But yet we can actually stand up without falling. So yeah, besides of the muscles that actually do the job, fascia is actually also another thing, and also ligament. Right. So what time now? Okay. Now, so adult dancers has more, is actually training in a more challenged way. The movement when you are getting like higher and higher grade. So young dancers is like, oh, mommy, it's so hard, I don't want to dance anymore. Every grade also you will heard this kind of like excuse. Oh, my daughter said very hard already, don't want to dance anymore, right? Yes. So if let's say you prep them in a very good structures, you actually this question will kind of like minimize. Yep. So my previous teacher, Mr. Wong always say, have a good structures before you dance. At that time, I don't understand. I was thinking, why I'm doing dance la. So like, it's like, what is he talking about? Now I do understand that. Yes, you do. You will give a very easy job for your dancers if your dance conditioning I'm doing very good. So movement developed from a very creative dance form base from a young age, and later on to a very technical demand dance move. So like on point, your surface becomes so small, right? And when you're on point, you can see most of the dancers like they struck up shoulders to kind of like holding themselves. And when they are dancing, they forgot to breathe. So that's why your artistic level is kind of like dropped, because they're holding the tension and just uncontrollably. And then your cueing is always relax. I think you really need to kind of like calm down. We call it save your energy, because they don't do it. That they would not do it so easily, because the muscle memory is built such a way. You have to erase the memory, the tightness memory, before you inject the relax information. So the relaxed way is like how. Okay, now, so padada, when the guys carry you here and there, and then you don't just sit on his hand and let him carry. He will quarrel with you and then he won't want to dance with you anymore. So in ballet, lightweight anti-gravity, not just ballet, all all form of dance. Now, recently, actually, not recently, I'm actually a very nature people. So have you ever thought why the tupai? How suddenly I cannot remember this in English. What is tupai called? What's the tupai called?
Squirrel.
Squirrel. Yes. Why the squirrel can actually flies off the gravity? Have you ever seen, yes, squirrel, yeah. So have you ever seen all the animals that can actually anti-gravity, but why not human? Another thinking. Sorry, you gotta exercise your brain for this hour, yeah. Good for your anti-ages. Use more brain. Okay, right? Yes, yeah. Most of the animals, they actually light. Cats, they can just think, oh, they're on the ceiling already. But we are like staircase lah, whatever climbing techniques, all think about sweating, and yet we haven't climbed up to the ceiling yet. Okay, and fear factors, all these effects. So, oops. Next one. Sorry. Okay. So have you ever thought, what do you have in mind for the choices of dance conditioning? So just now Shi Hui already mentioned Lisa Howell. Yes, she's actually one of the techniques actually quite useful and good. And then have you ever thought anything else? You can actually key in typing, can share some, so that I know, so that I can know what is your choices in your mind. Yeah, no. Oh, everyone don't do dance conditioning. Very good. Gyrotonic, Kinase, Pilates. Yeah. I'll share all this. Okay, everyone's so shy. Okay, right. Now, next one. How come my screen cannot take it? Okay, so now, how does overseas professional dancers train? Right, I'm sure you Google it. Don't Google only see how good they perform, but Google why they can move so well, and what are the training floor bar. Yes, I will include that, Mingmi. Thank you. So how does all these overseas dancers trained? This is right. Okay, right. This one, Pilates. This is one of Pilates on the trapeze equipment, trapeze table. Brent Anderson, this is the guy below. He's a physiotherapist in Miami. He's he's the Postup Pilates inventor. Later on, I will share some of his work. He's doing some advanced move on the rehab on these dancers, to working on the spine mobility, strength, and also balance, right? The trapeze table, besides that, this one, we had it in our studio. You can also use spring to assist the dancers, either to kind of like prevent injury or recovery from injury, or you do it as a normal, like a dance training, dance conditioning training. So necessary that you injure, then you come on this table, not necessarily. Yeah. Met Pilates, Sydney Dance Company, they are doing single leg bridging. Shall we do this later? Yes. No. So we do it later, and I will give you some idea, my approach, and some of the understanding on the details on what you should look at. So do not just copy the movement, and then yeah, so some of the details that you really need to kind of like look at to prevent some of the injuries. The next one, yoga. Yoga area yoga, that you can see that, you know, they use all these cloth thingy that actually build a very good strength. But when you're doing this, is you got to be careful, because when this is only one of the movement. When you're doing this, right, especially when you're hanging yourself up on the instability environment, some of your tightness or your old habit, which is inefficient on treating movement, you actually grabbing. So you really have to be careful grabbing in order to perform the movement. All the movement would have a pros and cons, weakness and strength. You will need to kind of like judge what is the benefit of the exercise. Yoga ball, yeah. Anything related to yoga, even though we don't use any props, they are actually good. Now, learning from a certified practitioner is most important. So yeah, I mean, follow YouTube is one of the, but you only copy movement. You don't copy principle. It's a principle behind the theory behind the movement is the juices, is the knowledge. So you cannot avoid that. Yep. Right. Next one. Okay, this is by another method by Eric Franklin. He's the guy that wrote a book, Imagery, Truth Movement. He has this kind of like, you can see right here, this concept using TheraBand that many years back I already used TheraBand to kind of like improve for my student. Yeah. And that time, I think, do I ask my student to buy a band? Huh, Fion? I forgot. Do I? Yes, yeah. I do actually ask every student own a TheraBand, at least a TheraBand. It's cheap, easy to bring, easy to store. You bring it anywhere when you prepare for your performances, prepare for your workshop, your exams. You just take it out. Yeah, right? Yes, the dance conditioning for Eric Franklin, right? This one, yeah. This is one of the book that he wrote. Yep, very good, Priscilla. Yeah. So by using the imagery, right? Yes, you can see there he can create a lot of sorts of different images for dancers. Yeah, to relate to. So dance conditioning is not just I have to sweat, I have to work, work it hard enough for you to feel the muscle. Is actually not. So yeah. So this one, the dancers on Gyrotonic machine, and yes, we have a few machines in our studio to work on the clients. Yeah. And the pulley tower, this one called pulley tower. Gyrotonic actually have 5 specialized equipment, and also gyrokinesis. Later I will share. Gyrotonic is the one that you work on the machine using. For pulley tower, we are using weight. So using all the straps, right? Straps, and allow the dancer to move freely as compared we're using the springs on the trapeze table. That one more restrictive. This one you can move more freer, and we can add different weights to create more different strength training, and yet you can still move according to your dance, the dance move. So there's a specialized course also application for dancers. Even though you don't really, as a dancers, you don't really need to, do like, so you don't like make a course say, I want this application, the Gyrotonic for dancers. Not really. A basic Gyrotonic training is sufficient also for a dancer as a dance condition. Okay, gyrokinesis is on stool. Both Gyrotonic and gyrokinesis actually invented by this guy, Giulio Horwell. He's still alive. Joseph Pilates, he died. So this guy, he actually dancers. So all these guys is because they have problem. They invent a method to kind of like prolong their not just dance life, but for health purpose, right? So yeah, he is the former dancer, principal dancer for Romanian National Ballet Company for the age of 21. So what I understand is the Houston Ballet Company actually doing gyrokinesis for the morning class. That one for one of my master trainer that share. So see, overseas dancers already, you know, kind of like branch out to some other thing, not just limit to dance training. Now this one, floor bar, founded by Zena. He was a ballet dancer and dies at age 90. Floor bar is actually floor bar as you see the name. So when you're lying down on the floor, like for example in these pictures, you could actually do a badminton, do a ground badminton or développé types when you are lying sideways. So it's actually more challenging because the front back muscles has to kind of like balance to recruit in order to perform this movement. Now, if you are copy this movement to try it out and experience it, the keyword is you're going to try to keep your trunk stabilized. You only allow your hip joint to move. Okay, please pay attention that. If you're doing like one whole song with your pelvic rocking here and there, the efficiency is kind of like downgraded. Yeah, it will decrease. Can, right? Now, on the Bosu, Bosu is this thing. You can actually flip over, the flat side will be on the floor. Now, comparing this one to the feet ball, feet ball, you can't really stand on like this. You will fall down. It's very dangerous. You wouldn't want to have crutches and see your friend doing it, right? So this thing is now all of these movement, you will have a risk of injury if you're not doing properly and focus. So it actually balances the need of many form of muscular sling, front, back muscle, leg muscle, all travels up, right? Yeah. So Bosu is one of the thing. I think you can actually buy it from Decathlon. Yeah, right. And next one, foam roller. Foam roller. The foam roller, this long thingy thing, this movement is actually to train the dancers on the back extensor. If you want to do like training to kind of like strengthen your penché, your arabesque, all your back bend muscles. This, but when you're doing this movement, you got to really be careful. Look at the last one, the little girl. She is doing with all the shoulders struck up. It probably also because the height of the size of the reformer is kind of like too big. Her size is quite tiny, right? Okay. And you know, I never tried this before. You know, the one that you see it in the Toys R Us, the swimming tube. I don't know how soft it is. I never tried that before, but for our area, if you want to try this movement, you can actually use that, the Toys R Us kind of like tube, the swimming tube. Try it. So when you lift up, bring up your spine rather than strut up your shoulder. You're going to keep your shoulder down. We are training the spine muscle, not the shoulder muscles, bear in mind. Okay, right? Now, the next one, this guy called Petrol. He's a former dancer for a great national ballet company, and he's doing a side plank on the reformer. Now, this thing, we also have it in the studio. The carriage, it will actually slide in and out. The bottom part controlled by spring tension. The spring tension can put on very strong spring or very light spring. So many people will think, oh, strong spring sure hard one. No, not necessarily. Lighter spring is actually harder because you need to control the carriage not to fall out and your whole body fall down. So more tension will actually helps you to kind of like glide the carriage out to control the stability better. So this works on the arms, the core stability. That's the almost like whole body movement control. Okay, right? Besides this movement, you can also use the reformer. You can actually Google it, the reformer for dancers, right? They use the jumping stretching board, the jumping board that actually give feedback for dancers to working on the, like we train dancers on these machines to do jumping, cabrio, sautes, to train a good jumping pattern, right? Yeah, because when you're standing, right, you ask your student, 不要用那个 shoulder, don't use your shoulder, don't jump from your chest, but how? So yeah, so when they lie down, they reduce the anti-gravity force. They can focus on the jumping and relate the whole body in a better form. Okay, right? So next one, the PPT. I'm sure you heard about these techniques before. It's also a very good techniques by Marie. So this is a student on the fit ball. You remember just now the photo that I showed you on the Sydney Dance Company. They are doing single leg bridging. This is actually a similar movement, but when the legs are on unstability fit ball, the ball will move around. So what you do, you grab your muscles to stabilize it. Now it's not that case. You are trying to engage your muscles in a more proper form. Okay, the keyword is evenly distributed your force to your whole body. Do not tense up just one area. Okay, just like in a family, your daddy or mommy goes out to kind of like work, earn the money, buy the toys you want, and what's your contribution? You clean the house, you wash dishes, you be good girl. All right, that's the responsibility. We evenly distributed the responsibility, right? Body the same. You ask all the whole body parts to work on it, but not just only gripping on one area. Okay. The ball also on the Bosu. Bosu is half size, but this one is rolled 360 degree. Okay. Now, Karen Gardner also, she with Tom Myers, who is in anatomy trains, to form, Tom Myers actually a body worker working on fascia that you can actually have a look of that also. Then Karen actually partner with him to invent the movement to match with his sling concept, the anatomy trains concept. So as you can see all the lines that how does actually a movement need to kind of like pay attention. So it's not just like move your arm, move your legs, but it's actually a connection. So this is about fascia. Yep. The next one, Lisa Howell, physiotherapist. His work actually closely on a lot of topics on injury prevention, recovery, performances, enhancement. You can actually go and Google it. At this moment, everything is on Google. So look at his work, her work, and see if you can learn something from there, right? Okay, now, so what else you can actually do? Weight training. No, okay. Weight training is not the one that you think in gym that they build the muscles, bodybuilder, bulky. No, we don't want to build that way. Later you cannot jump off the floor. You are landing, you ended up always grounded on the floor. So the muscles bulkiness that we actually need to kind of like be careful. We as dancers, we build our body low, lean and tone, right? We don't want to build and bulk. So stretching you already do. So sorry, weight training, right? That you can actually choose appropriate weight. Later I'll talk about that. So stretching is the one that you already do, right? You already do. Stretching is all the time, like whether on floor or on the bar, right? Yeah. But you gotta be careful. If a teacher still using a technique that always press, you really have to be careful. Yeah. The ligament once gets stretched out, they cannot come back. So once you injured that, they cannot return the length. Muscle can, fascia can, ligament cannot. So you really have to be careful when, especially comes to the point that you want to train your young age dancers to stretch in a proper manner. So somatic movement training. Somatic movement training like Feldenkrais, awareness, truth movement, Alexander technique, and Rolf movement. They're all the techniques as a very, very slow technique. It's kind of like, again, to improve your proprioception's awareness, mind and focus, right? So there's actually many more. You have to think about how to choose an appropriate the props. Oh, hang on. The props. That. So choose a dance conditioning, and then besides that, how do you choose props and equipment? I call it toys. Yeah, everyone like toys? The kids, Aurelia, yeah. So the toys is not the dinosaur and the dog. Now, magic circles, a round shape made by a steel ring shape that you can actually work on the engagement of your, like for example, inner thigh muscles, right? When you do a plie, you put the ring in between, you ask them to slowly squeezing it to engage your inner thigh, the adductor muscles. You have your hands holding in front, magic circles, squeezing it to work on your first position's arm or fifth arm, and then ask them to squeeze. It works very good, but yet you have to kind of not just squeezing the ring, but you have to engage to a proper muscle so that they don't struck the shoulder hiking up. So you have to really be careful of that. I'll talk about that later also. So foam roller is the one that I already mentioned. And then the weight is the one, the dumbbell, right? 1 pound, 2 pounds, 3 pounds, right? Depends. And depends on how you use it, and then how much strength you have. Then resistant band, the stretchy band, the Bosu or the wobble board, which is actually quite a similar equipment or apparatus. So all the Pilates equipment, chair, trapeze tables, ladder barrel, reformer, springboard, all these things, and the Gyrotonic equipment, like a pulley towers, also the leg extension, jumping, stretching board, jar toner, and archway like this. So yoga cloth, the aerial yoga that I just showed you, and different sizes of ball. So the ball doesn't just limit to a feet ball. You could use a different sizes of ball, even use the ball to release the muscle tightness. All right, like using tennis ball. Tennis ball is cheap. It's cheap, and you can use it to release the tension, right? Even mommy can use it after the housework, right? Yeah, Mrs. Lim, you can use it. Okay, now, so what if, let's say you are in the studio? It's not necessary to ask you to go to the studio, to engage a class. What if, let's say, you as a dance studio owner, you don't invest such a heavy and expensive equipment and then do all the certificate. So mat. Now, when you are training your student, I'm not sure whether are you particular using mat or not, but for my experience is because of the bony landmark, certain area is really painful. It's really, really painful when you lie down sideways or lie down back. So the bony landmark, when they are lying down, and when you do movement in curl or roll down, when they are in pain, they will change and shut down their nervous system. They protect it. They would not release the tension. So teachers, you got to really kind of pay attention. If you don't use mat or use mat, the different. All right, ask them to bring a yoga mat if you really decide to do a conditioning class. So yeah, now yoga mat is thinner, Pilates mat is thicker. So you kind of play around which one do you actually prefer. So be creative using the props, but you have to be safe for all these things that you use. Now, knowing your teaching well, your intention for your dance conditioning. Do you want to strengthen? Or do you want to improve flexibility? Right? You have to know your intention when you come into design of your program. Right? They are different. Right? Okay, the area to focus. Do you want to work on your joints, or do you want to focus on your myofascia? Myofascia is the muscles fascia. That they both are interrelated. Like I say, muscles and fascia, they are all close together, right? Yeah. So what? Do you want to kind of like work on the physical or mental? Mental as in like, you know, you cannot just work your dancers. Come on, dance. You have to have them to kind of calm down. So breathing, right? External space or internal space, right? External space as in, do you want to work on the spatial near the studios only, or internal space to kind of like feel the space, like breathing? Everyone, you can actually place your hands surround your rib cage like this one. So just place your hands like this around the rib cage, and have your inhalation to let your diaphragm to expand. Now ask yourself, not too fast. You are breathing like you are having dinner with your friend. No one will notice your breathing. Hey, that day that one is like running after like running marathon. No. You just breathe and kind of sense, how does your rib cage expanding? Are they moving 3-dimension fully, front, back, side, or are they just move for front? So some of the area will be missing. Pay attention on that, right? So that's why I say we are working a body as a whole, right? Okay. Now the next one. So when I was as a CBTS 4-2 tutor, teaching TA is a transverse abdominals. TRANVERSUS, transversus abdominals, something like that. I suddenly like cannot. Transversus abdominals. They are actually just have one pictures in the manual. I was thinking, how am I going to teach this muscles theory? I don't even see my student. I only can key in to check their assignment. It's very challenging because I used to teach these muscles in the Pilates sessions. I got to touch my students, clients, and then to tell them, now this is the layer, this is not the layer, like that. So teaching in the paper is very challenging for me, okay? So yeah, but during the course, there's a Pilates has actually mentioned also, RAD in London HQ. They actually own a Pilates equipment studio in London HQ. Yeah. So if you happen that went there before, and probably I'm not sure now they have it or not, go and have a look of those studios. So when students do a warm-up and cool-down exercises, the things that I would actually ask the students to improve is, see what they give, what they actually written in the assignment is, they actually prepare all the pliés, tendu as a warm-up. So now you want your student to do pliés and tendus later on in your dance syllabus. And you are using warm-up, plie, all these things as a warm-up. So you can actually focus on different orientation. Orientation, like for example, floor bar, ask you to lie down. So floor bar, that one, the exercise is just side lying. You could actually ask them to lie down flat. When you are lying down supine, your body will take off some of the tension that your own pattern. Fascia will actually remember a pattern. You remember the kids' posture, the picture that I just showed you, when they are in arch or lordosis curve postures, you cannot ask them, don't arch. No, you cannot. You will just waste of your energy, because the pattern forms such a way. You have to rebuild the muscle memory, what you want to strengthen in order to lengthen the tightness. Then only you have to, then only you remind them, now this is don't arch postures. Yeah, okay. And also base of support, when they are all in standing position, right, it's already challenging. Like I say, on point, it's so hard, the surface is so small. Somehow you have to balance on one leg, and then no hand, and then turn, and then jump, and then wow, and then so many of dance movement to kind of like focus on, also on the musicality. So people tend to forget how the body needs to perform again, right? So the liver length, now to lengthen the leg out, to do the grand battement, and also bend your knee to do to work on the hip mobility, they're actually different. Okay, right? They're actually different. Now, examples, I would use a gyrokinesis. Do you, okay, I think it's now 12 o'clock. Do you want to experience movement, or I'll just kind of like straight go to the Q&A questions part? Do you want to experience movement? Yes, no? Yes, yes, no? Okay, now everyone, push yourself away, sit on the stool. Push yourself away, sit on the stool. You're gonna really on the camera so that I can see you. Sit on the stool and right. Yeah, sitting on the stool, not on the football, on the stool. On the stool. Your feet open the legs slightly. Open the legs slightly, not your feet. Open the legs slightly. Yeah. Aurelia, you're gonna sit on the chair, not on the floor. Right? Then you're gonna keep your spine upright. Okay, yes. Now, gyrokinesis is different from Pilates. It's working a lot of mobility in your spine to loosen all your joints. The spine consists all different vertebrae. So now, when you inhale, you shine out your chest up towards the ceiling. Shining out your chest up towards the ceiling. Yes. Now, yes. And then you hinge and lean forward. Lean forward. Lean forward. Yes. And then you curl your tailbone, come back like a snake. Good. Yes. Inhale, sit up tall. Arch again. And exhale, forward. Wave like a seaweed. Exhale. Watch out your neck. You break your neck already. Lie. Is it called lion? Lion? Lane? Lane? Lane. Lane. Okay, now inhale to sit up straight. You're going to watch out all this breaking your neck. So wave your spine forward and then come back. And curl from your tailbone. Aurelia, you're going to put your feet on the floor. On the floor. 两只脚在地板上。对了，然后屁股坐前来一点点。Yes, pay attention to the spine that actually, yes, moving through the every single vertebrae from the tail up to your head. Let's do 2 more times. Inhale, shine out the chest. Exhale, and then lean forward and curl back. Yeah, good, good. Yeah. So this is just a very brief experience on you. Ming is actually also teaching gyrokinesis class on Thursday, and I also teaching. Me and Ong also teaching gyrokinesis. If you're really interested, maybe you can get our contact from Priscilla, like that. Okay. So yeah. So gyrokinesis, like I mentioned before, is like a contemporary dance. They focus movement in a 3-dimensional way, whereas Pilates will focus movement in a more 3-dimensional way, a two-dimensional way. Now, as you can see, the fascia layer, right? The fascia, the layer actually fascia divided into superficial layer and then a deep layer. It's like an onion. Our body is like an onion. You peel off one layer, and then there's another layer appear. So when I do body work, when this layer peeling off, right, the tension is kind of like ease off. Another layer, the problem will kind of appear out. So sometimes, yeah, that's why you will see how many sessions do I actually need? We really don't know. It depends on your structures. So gyrokinesis is same family as gyrotonic. It's just that Julio, he differentiate the names. So when you say I do gyrokinesis, we know that you're doing the work on floor and on stool, right? When you say I do gyrotonic, we know that you learn movement from equipment. Yeah, okay, right? So the next one is the example of Air Franklin and some of the somatic work. Now this one, you go, so I need a chair. You're gonna sit down, with your arms hanging heavily sideways. No, just hang down vertically. Yes. Okay. Now, just think about your right shoulder, right side of your shoulder. Hanging up, must hanging down, your arms hanging towards the floor. Your right shoulder. Yes. Then you feel that the right shoulder is kind of heavy. The water dripping down from your shoulder joint all the way down to your arm. It's like a dripping the water. And you use the breath to follow the flow without side bending of your body. You're going to keep your spine upright. Yes, I know it will like, oh, how come they're pulling me? Now you have to keep your spine upright. You only feel your arms. Now slowly reaching your right arm and like you are moving your arms forward to touch the front of the wall. Like a balloon under your arm, floating your arm up. Slowly. The balloon is floating your arms under your arm. Slowly lifting up. Angie, you're going to feel your shoulder joint to feel the balloon floating under your tricep, your upper arm tricep. Yes, that's different. You feel different, Angie? Yeah, good, good. Now, all the way up towards the ceiling. Yes, now the balloon tight on your fingers and your wrist. It almost wants to pull your arms, the joint out from your socket. You still keep breathing. You still keep breathing. And you feel that your whole arms is kind of like the balloon helps you to bring all the way up towards the ceiling. And then slowly lower down your arms and feel the floating sensation. Yeah, yeah. Just feel the balloon. The balloon is carry your arm, not your arm carry your arm. There you go. Yes. Now, are you able to notice which side of your shoulder is higher and lower? Can you feel lighter on one side? Yes. So see, we don't need hard work to release tension. Correct? Why do we need to move and move and move and then you feel release? Yeah, I don't feel release, I feel more tightness. So yes, so breathing, imagery, all this, yeah. Okay, this is one of the experience and examples led you to experience. Now, Pilates using floor mat. We do the Sydney Dance Company, the one that they train them. You able to on the floor? Come, lie down on the floor. Wow, ballet teacher anytime can set the venue. Very good. Very experienced and very ready. Okay, you lie down your spine on the floor. If possible, right, tilt your camera so that I can see you. I can correct you if I see mistake. Yes. Okay, we're doing bridging, correct? Now, Aurelia, you're going to bend both knees, pointing your ceiling up towards the knees up towards the ceiling. Very good. Now, the knees, no, the feet on the floor. Yeah, you copy the teacher next to you, okay, the video. Yeah, the feet on the floor, the heel on the floor. The heels on the floor. Yep. Now, the feet has to be wide to your sit bone width apart. Sit bone. How big is your sit bone? Yeah. Later you sit down, you shake your butt, you feel the bones, okay? All right, now let's everyone look up. I'm not going to demo. You don't need to see me. You just need to listen. Okay. Now let's everyone bring up the pelvis up to the heel. Bring up. Bring up. And then put down. Pelvis, Katie. Pelvis up, not the leg. Pelvis up. Your leg is too far already, Katie. Bring in the leg some more. And then put down the leg. Put down the pelvis. Lift up the pelvis. Up. 1. Higher. And then lower down. Put down the pelvis. Pelvis are Katie and Aurelia. Yes, no. The pelvis. 那个屁股拿起来。屁股. And then down. Yes. Yeah, 屁股对。And then now, see, this is the cueing that I don't cueing for safety. I just ask you to bring up, bring down, bring up, bring down. This is very harmful. Now, doing appropriately, can you curl the tailbone up? Curl the tailbone up to peel off and feel the bone one vertebrae at a time. Very good. Now, you reach out the knees over the second toes without popping the rib cage. You don't need to go that high up yet because I want you to engage your ribs to your pelvis. Yeah, that's right. Now you're going to draw down your shoulder, So Ming. Yeah, slide down the shoulder to elongate your neck. Your palms facing down if you can. Palm facing down. Pressing down your arms on the floor and draw down your shoulder, reaching your arms over the toes. Very good. Now pull your spine, head and tail to the opposite direction so that you keep decompression on your spine. Now inhale to prepare, exhale, roll down your spine. Again, no jump cue. Tailbone is always the last one to come down. You're articulating back down one vertebrae at a time. Coming back down to your, yes, a flat pelvis position. Very good. Now, okay, get up. Can stand up already. Enough. I won't cue you doing one leg because you're not warm up. So yes. Do you have any ideas? Can you feel difference when I ask you, okay, bring up the hip, put down the hip, bring up the hip, put down the hip. And when I ask you to kind of like give you details, articulate your spine well, you know, how to begin, where to take care, like that. You feel different? The one that is doing it? Yeah, yeah. Okay. So there's the Pilates that I'm actually currently doing it. Postup Pilates is actually an invented and evolved Pilates method. It actually by scientific research on movement. So Brent Anderson, the guy, he's actually came out with a very good among the syllables. Not say that others not good. It's just that this is what I've been doing it for the past 16, 20 years. Yep. So this is what I'm doing it using this Postup Pilates concept. 6 Pilates concept, breathing. As I just now when I, the breathing. When you move your arms, you tend not to breathe. Okay. And principle number 2 is exhale elongation on core control. You elongate your spine, right? And you work on your core muscles, right? And spine articulation, we have to let our spine to move freely, right? So, yeah. And head, neck, shoulder organization. So I keep on asking you not to hike up the shoulder. If you keep hiking up shoulder, you do your fifth positions, arm will be all the time hiking. You have to let your neck, but letting your neck setting it elongate and let your shoulder setting it down, you need other muscles to support, right? Okay, your alignment of your extremities. Extremities, your arms and your legs, right? And your head, right? On the weight bearing as in your like on your fore, like on your cats, like weight bearing when you are standing. Right? So in ballet, most of the weight bearing exercise is only standing. Contemporary, you still need some arms work. But when you're doing conditioning class, you have to kind of pay attention on this alignment as well. Right? So when you choose the dance conditioning exercise, I hope you really pay attention on that. And then later on, movement integration. This is kind of like the last bit that is quite complicated, but you just have an idea of this, the terms movement integration. Okay, right? Now, 4 stages. You are unconscious, you incompetent. You are not aware and you cannot do it. You don't even know that you're actually hiking your shoulder, correct? Right? Yeah. Then you conscious, but you are incompetent. So when you do bridging, you know that you cannot hike shoulder. You try, you think, oh, cannot. So, but you still cannot. But the higher the pelvis, the higher the shoulder. So you see the stages. So when you train the dancer, you have to really pay attention on that. They're not that they don't want to do it. Who don't want to be a good girl if they can? Just because they are not capable to, not able to perform yet. So then you are under the stage of conscious competent, means you have to think consciously, and then you can still do it. I can correct it finally, but you have to think about that, right? Now the 4 stages, you unconscious and you competent. You don't need to think about that because all your muscle memory erased to change. You're changing to the efficient one. Now you have to think to do the wrong thing. So when your body is kind of correct such a way, so like me, certain Pilates or certain movement that I need to show my student in a wrong way, I have to think how to do the wrong thing. So because the body already transformed. Can? Any questions up to here? No? I could see some of the chat. Sorry. Oops. Close my slide. Oh, sorry. I only see it now. Okay, right? Okay. Every time I check box. Any questions up to now? No? Okay, I let you think while I share my screen again. Take some time. Oh. So I hope to give you the ideas for today's talk, right? To have some guideline. And now, always say you have to be open-minded to be a teacher or a dancer. It's actually a lot of things out of the box. Like I said in my write-up, during my experience teaching as a ballet teacher, be a Pilates instructor and also Gyrotonic or Kinase instructor, it's actually allowed me to think out of the box when I come to design and improve my students' dance performance, and upgrade yourself for your CPD in a different forms of, there's actually a lot of things that you can actually improve, like anatomy, not just movement. You really need to kind of like brush up your knowledge in anatomy skill, because if you don't know your body structures, you wouldn't know what they need to move and how they're actually moving, right? It's very boring because all the language you don't speak before, but by the year, bone and muscles won't actually change. You after 40 years also call skull. They don't change, right? The deltoid is still called deltoid after 100 years, unless they invented something, I don't know. Yeah, so this knowledge actually is your asset. Yeah, is your asset. So there is an upcoming Postup Pilates training. Gateway Mat Level 1 is a 2 days physical course. Supposedly it held in July, but because of MCO, we don't know whether MCO lifted. If let's say it's not lifted, then this course will be pushed in August. So if let's say you are open to this course, then you can actually get the contact, my contact from Priscilla. I'll explain to you. And if let's say any one of you would like to know more about what Postup Pilates courses like, I can actually host a free talk about the whole program to become an instructor program also. Yeah, this is for free. Yeah. So Postup Principle is an online course. You don't need to attend physically. It's the 6th principle that I just mentioned over there. If you only want to have a theory base of knowledge, then you can actually sign up for this one. Also, get my contact, and then I'll send you the link for you to register like that. Okay, right? And who is typing there? Right. What exercise to help a student who has hunchback problem? Any idea? Okay, sorry. this is the one that I finished my talk. Now let's Q&A. What exercise now let me ask you, what causes hunchback? What muscles that actually not strong to create? You can actually unmute. Wait. Stop. Okay. You can actually unmute yourself if you want to ask questions. By the way, it's actually overtime. If you want to leave, you can. I just have 2-3 questions and then we can dismiss. Yeah. So now when you're in hunchback, right? What muscles actually in weakness in core? Not really. They actually curve forward. They don't have strength at the back, right? They don't have strength at the back to sustain a person in upright, right? You got to do something to work on the back muscle or the side muscles, the oblique muscles. So it's not everything related to core. Core is not just everything. It's not 100% to perform your whole daily activity. Not really, right? Hang on. Low self-esteem, yes. You also can, in the terms of low self-esteem and confidence, a kid that lack of confidence. Now, why are they lacking of confidence? Because they cannot perform the work, right? If you can make them to perform the work that they feel they are like, they feel they are like a what, they are not capable to. But if you are able to make them to kind of improve the self-esteem, you can actually improve them. So hunchback is something that you need to work something at the back. Now hunchback also, when the bony area is kind of like so tight, you are doing the foam roller, the one that I show you, right, on the back muscles, and you try to force them to do that exercise, but because they are weak, they are not just weak in muscles, they're also tight in bone. You have to be careful that because you will actually injure them. They will try to force themselves to get up. So you have to be careful. Yeah, do I answer your questions, Shiwei? Yeah, Chi, yes, the spine in hunchback, yes, the upper back, good. Yeah, nice. So think about that. When they cannot perform, is that the bone or the muscles? Think about that first. Now the joint turn out. They cannot perform turn out. Why? Is that the bone or is that they are weak? Some of the structures, right? The pelvic area and the femur bone, the joint area, they actually bone in such a way you can't really force them over the range. If you're over the range, right, you actually injured them, and it's actually quite harmful. So that's why I say you have to kind of like study more related anatomy courses so that you see structures like an X-ray eyes, so that you can design a program that can safeguard your student. Yep. Any more questions? This course or workshop is only meant for adult or child as well. Which course do you mean, Katie? Katie, do you want to speak? You unmute your mic. Where's Katie?
Hi, I'm Katie's mommy.
Hi, yeah.
Yeah, hi. I've gone through the whole session today.
Yep.
It's good that many types that could improve the posture, and also but it seems like more for adults, not so much for the kids.
Not really. Okay, now the course, the workshop, as in for this one, or the one that you meant for your the Postup, or you meant for our classes? Which one do you actually mean?
Okay, I'm keen to have that it's for my daughter Katie. Of course,
Right.
that for myself, I do attend reformer classes.
Okay.
So it'll be good. Then
Yes.
it'll be mother and daughter same time. Yeah. Then that
one, our physical class on the reformer, right? Which studio do you go last time?
Urban Spring.
Okay. My studio just next to Urban Spring.
A chorus.
Beyond Movement.
Yeah, yours is at Bangkok.
Bangkok, Opus.
Our Beyond Movement, is it?
Yes.
Yeah, because I go to a chorus. So it's a new center. So which means that you do have that is the adults and child's classes.
Yes.
Okay,
Yes.
then it'll be good.
Well, that one will have to wait for MCO lifted. Then only we can. Yes. Yeah. You can join together because sometimes I do encourage mom, instead of waiting there, do something for yourself.
Yeah.
It's just waste of time to send them to there and sit down there. Why don't you do? Because this is not just for children.
Yeah, that's why I want to have some, because since it will be talk about during these sessions, right, that it will be good to have or to join the classes that it's, you know, mom will have one adult sessions and then child will have the child sessions, then both will benefit within the same duration rather than I go for my classes and then my child go for another classes.
You
so
can actually do a duet class. Some do duet classes with the children.
No, not for duet classes.
How old is Katie?
11.
11. We actually have a children class. 3 boys doing Pilates.
Okay, all right.
Yeah.
But because Katie have some difficulties in some movements, so I thought to improve in certain, you know, better equipment or strengthening courses that could help her in terms of.
Okay, now, like I say, right, it's not necessarily to just focus on machines or non-machine space. There are all, you know, combinations that actually helps. So you're going to do these conditioning classes depending on your convenience. Like, for example, now, actually, like I say, we do have online classes, right? Like me, and then on, we actually do some of the online classes. Maybe you can actually get some information from Priscilla later and check out the timing that suits you and Katie. And yes, join the classes, not for conditioning is not just for dancers, it's for everyone's health issue. Yeah.
Yes,
yeah.
that's good.
Yeah.
Thanks, Ms. Gan.
Thanks. Any more questions, others? Teachers? No more? Then I will say thank you to all of you. You are always welcome to get my contact and text me if you have any questions that you cannot think of or shy to ask now. Right? Dancers usually quite shy to ask. So yeah, I pass it back to Priscilla if you have anything to add. I'm so sorry, I delayed time, so many to share. I thought I cannot finish 1 hour. Yeah.
So sorry.
Kassin, I remember the name. I think you are the one that also in my CBTS, is it? If I'm not mistaken. Yeah. Right, yeah, Priscilla, I pass it back to you.
Yeah, thank you so much for the teachers, parents, and students who attend. I hope you can share, because we have another 2 sharing on Wednesday and Friday. You can share it to your friends or to your students about this sharing. And of course, all the donations will go to CESO Malaysia. Okay, and good news is we already have the targeted amount, and we're going to donate it to CESO Malaysia's by this weekend. Thank you so much for your donations. And also, Ms. Gan, thank you so much.
Thank you. Thanks, everyone. Anything, just text me. Yeah, bye.
Okay, take a good picture before we go.
Can.
Yeah, Kassim, thank you. Please on your video if possible. Yeah, everybody on your video.
Okay. 1, 2. Okay.
Right, thanks.
Thank you.
Thank you. You can leave now. Have a nice.
Thanks. Bye.
Thank you, Ms. Gan.
Thanks. Bye. Bye.
Minnie, you can try to share the screen. I'll make you a I will make you a co-host. Hi, by the way, hi Minnie. I never met you before.
Hello, yeah.
I'll make you into a.
Before this, I only